Which of the following is the most likely causative organism of this patient's condition? So, a 45-year-old man with a history of alcohol use disorder and cirrhosis is admitted to the hospital with worsening abdominal distension and pain. Physical examination reveals a distended abdomen with shifting dullness and a positive fluid wave. Paracentesis is performed, and the ascitic fluid analysis shows a polymorphonuclear leukocyte count of 400.
So what's the diagnosis?
So I think the diagnosis is poly something with cirrhosis. It's basically like when you have cirrhosis and you get like a bacterial infection.
Okay, good. I like it. You're describing it. So it's called spontaneous bacterial peritonitis.
Peritonitis, yeah, sorry,
Okay.
peritonitis.
So it's like your ascites or your fluid, right, that you get in your abdomen gets infected, exactly like you said. Okay, good. So you got the diagnosis. Now talk to me. What do you feel like the organism that's most likely here is?
So it was definitely, from what I remember reading, it was bacterial.
Okay, good.
Um, I want to say it was gram negative, if I'm remembering
Okay,
correctly.
good.
Um, yeah, I think it was gram negative. So I'm going to go with E. coli.
Okay, good. Final answer.
Yes.
Okay, good. So I like how you work through it. Okay, you got the diagnosis, and then you're thinking to yourself, okay, what do I remember? Okay, so I want you to remember that the reason why people with ascites can get spontaneous bacterial peritonitis is because the theory is that some of the bacteria leaks from the gut, right, from the
Mhm.
colon or the intestines, and then gets into that fluid, right? And so you have
Yeah,
to ask yourself, what organisms like living in your colon, right? And it's mainly E.
E.
coli and
coli.
gram negatives, right? Pseudomonas, not so much, right? Doesn't really live in your gut. C. diff, yeah, it does, but it's not common that it causes bacteria, a spontaneous bacterial peritonitis. Mycobacterium tuberculosis, right? That gives you lung symptoms, right? Or TB,
Yeah,
right? And then Candida, right? That's yeast. That doesn't happen here.
no.